Welcome to the Certified Healthcare Risk Management Specialist course, presented by CDG Training. This course is designed to equip you with the skills to manage healthcare risks effectively. In this course, you'll learn to identify, assess, control, and monitor healthcare risks. These skills are crucial for maintaining safety and performance in healthcare settings. CDG Training offers flexible, self-paced online programs for healthcare professionals. Our courses are designed to be applied immediately in real-world healthcare environments. Healthcare risk management is vital due to medication errors, cybersecurity incidents, infection outbreaks, and equipment failures. Effective management reduces harm and improves care quality. Healthcare risks have a global impact, affecting millions annually. Adverse events, infections, data breaches, and operational disruptions are significant challenges. Patient safety is a core objective of risk management. By preventing errors and improving communication, healthcare organizations enhance patient outcomes and strengthen team collaboration. Healthcare organizations face various risks, including clinical, financial, and cybersecurity. Managing these requires specialized strategies and dedicated professionals. Compliance with laws, standards, and accreditation is essential for healthcare organizations. Strong systems support risk management and build trust with stakeholders. The risk management framework transforms uncertainty into informed decision-making, helping organizations reduce harm and build resilience. Healthcare risk specialists support patient safety, conduct investigations, and assess risks. Their role is crucial in strengthening organizational resilience. Digital healthcare introduces new risks, such as data breaches and device vulnerabilities. Understanding these is crucial for effective risk management. This course covers healthcare governance, risk identification, incident management, compliance systems, cybersecurity, and enterprise risk management. By the end of this course, you'll be equipped to identify risks, conduct assessments, investigate incidents, support patient safety, and build resilient organizations. Welcome to Chapter 1 of CDG Training. In this chapter, learners will explore the foundations of healthcare risk management. Healthcare organizations operate in environments where patient safety, clinical quality, technology, regulations, and financial performance are deeply interconnected. Understanding risk management helps professionals anticipate challenges before they become serious incidents. Risk is the possibility that an event may occur and negatively affect people, operations, finances, reputation, or compliance. In healthcare, risks can impact patients, healthcare workers, visitors, and organizational performance at every level. Risk management focuses on understanding these uncertainties and reducing potential harm before it occurs. Every healthcare decision carries some level of risk that must be understood, evaluated, and actively managed to protect all stakeholders. Healthcare risk management is a systematic process used to identify, assess, control, and monitor risks within healthcare organizations. It supports patient safety, regulatory compliance, operational efficiency, and organizational resilience. Healthcare organizations manage thousands of patient interactions daily. A single medication error, data breach, infection outbreak, or equipment failure can have significant and far-reaching consequences. Healthcare risk management has evolved dramatically, from a narrow focus on insurance claims and legal liability to a comprehensive discipline covering patient safety, cybersecurity, quality improvement, and enterprise risk management. Healthcare systems worldwide face increasing challenges that create new and complex risk management priorities requiring coordinated, international solutions. Effective healthcare risk management supports multiple strategic goals simultaneously, creating a protective framework that benefits every stakeholder in the organization. Healthcare organizations face a broad spectrum of risk categories, each requiring specialized controls, dedicated monitoring systems, and expert oversight to manage effectively. Clinical risks involve patient care activities and are among the most significant concerns in healthcare. These risks directly affect patient outcomes and organizational reputation. Operational risks arise from everyday healthcare processes and affect how services are delivered across the organization. These risks can cascade quickly if not identified and controlled early. Digital healthcare systems depend on electronic health records, telemedicine platforms, cloud infrastructure, and connected medical devices. Cybersecurity incidents can disrupt patient care and expose sensitive information at scale. Risk management is an ongoing cycle rather than a one-time activity. The process generally includes 6 interconnected phases that continuously reinforce one another to strengthen organizational resilience. Risk identification involves recognizing potential hazards before they cause harm. Organizations cannot manage risks they fail to recognize, making this the most critical first step in the entire process. Risk assessment evaluates the likelihood and impact of identified risks. High probability and high impact risks typically receive priority attention and the most robust mitigation resources. Effective controls reduce both risk likelihood and impact. CDG training emphasizes selecting controls that match organizational priorities and are proportionate to the severity of identified risks. Healthcare organizations continuously monitor performance indicators, incident trends, audit findings, and compliance results. Monitoring ensures that controls remain effective over time and transforms risk management into a continuous improvement activity. This example demonstrates how structured risk management can improve patient outcomes through systematic identification, assessment, and control implementation. Healthcare organizations often manage multiple categories of risk simultaneously. The chart below illustrates a typical distribution of organizational risk exposure across major risk domains. Monitoring incident trends helps organizations identify emerging risks and evaluate improvement initiatives. Tracking performance trends enables data-driven decision-making at every level of the organization. Healthcare risk management is a structured discipline that helps organizations identify threats, protect patients, improve operational performance, and support compliance. The concepts introduced in this chapter form the foundation for all future healthcare risk management activities. Healthcare risk management begins with strong governance and leadership. Organizations with effective leadership structures are better equipped to manage patient safety, compliance, financial stability, and operational resilience. In this CDG training chapter, learners will explore how leaders create a culture of accountability and risk awareness throughout healthcare organizations. Healthcare governance refers to the system of oversight, accountability, decision-making, and strategic direction within a healthcare organization. Governance ensures that patient safety, quality, compliance, and organizational objectives remain aligned. Without effective governance, healthcare organizations may experience inconsistent decision-making, poor accountability, regulatory violations, and increased patient safety risks. Strong governance creates transparency and organizational stability. Most healthcare organizations operate through a structured governance model involving boards of directors, executive leadership teams, department heads, clinical leaders, and risk management committees. This structure ensures effective oversight, accountability, and coordinated risk management across the entire organization. The board of directors provides strategic oversight and ensures organizational accountability. Board members review risk reports, approve policies, monitor compliance, and oversee long-term organizational performance. Executive leaders transform governance objectives into operational actions. They allocate resources, establish risk management programs, and ensure that strategic priorities are implemented effectively. Clinical leaders such as medical directors, nursing leaders, and department managers play a critical role in identifying risks, promoting patient safety, and implementing quality improvement initiatives. Healthcare organizations often establish multidisciplinary risk committees. These groups review incidents, monitor trends, evaluate mitigation strategies, and support enterprise-wide risk management activities. A risk-aware culture encourages employees to identify hazards, report incidents, and participate in safety improvement efforts. Organizations with strong cultures often identify risks earlier and respond more effectively. High-reliability organizations focus on prevention rather than reaction, anticipating failure before it occurs. Key characteristics include preoccupation with failure, deference to expertise, reluctance to simplify, commitment to resilience, and sensitivity to operations. Accountability means individuals understand their responsibilities and are answerable for their actions. Effective accountability systems support transparency, learning, and continuous improvement. Healthcare leaders must make ethical decisions that balance patient needs, financial considerations, legal obligations, and organizational priorities. Ethical leadership strengthens public confidence and professional integrity. Clear communication ensures that risks are identified, reported, escalated, and addressed appropriately. Communication failures often contribute to adverse events and operational disruptions. Healthcare leaders frequently make decisions with incomplete information. Risk-based decision-making helps leaders evaluate alternatives and select the most appropriate course of action. Governance structures support compliance with laws, regulations, accreditation standards, and organizational policies. Compliance failures can result in financial penalties and reputational damage. Healthcare leaders play a critical role during emergencies, disease outbreaks, cybersecurity incidents, and operational disruptions. Effective leadership ensures coordinated and timely organizational responses. During the COVID-19 pandemic, many healthcare organizations established executive crisis management teams to oversee resource allocation, staffing decisions, infection control measures, and emergency communications. Different governance levels contribute to healthcare risk management. The chart below illustrates an example of organizational responsibility allocation across leadership levels, from the boardroom to the bedside. Organizations with strong leadership commitment often achieve better patient safety outcomes, higher compliance rates, and improved employee engagement. The data below illustrates the performance differential between high and low leadership engagement organizations. Healthcare risk governance provides the structure through which organizations oversee risk management activities. Effective leaders establish accountability, promote safety culture, support compliance, and strengthen organizational resilience. Risk identification is crucial in healthcare risk management. Organizations must recognize risks to prevent patient harm and operational disruptions. This chapter explores methods to identify hazards and vulnerabilities. Risk identification involves discovering events or behaviors that may impact healthcare operations. It includes examining clinical, operational, financial, technological, and environmental factors. Early identification of risks leads to proactive measures, reducing costs and preventing incidents. Reactive responses often result in higher costs and potential patient harm. Healthcare risks can arise from patient care activities, staffing issues, technology failures, environmental hazards, regulatory changes, and external events. Understanding these sources is essential for comprehensive risk management. Internal risks require dedicated strategies, while external risks demand broader contingency planning. Both need careful management to ensure healthcare safety. Clinical risks are identified through activities like patient safety reviews, adverse event reporting, medication monitoring, and infection surveillance. These efforts support safer patient outcomes. Operational risks are identified through workflow reviews, staffing assessments, and performance evaluations. Addressing these risks ensures continuity and quality of care. Healthcare organizations must identify vulnerabilities in their digital infrastructure. This includes electronic health records, medical devices, telehealth platforms, cloud systems, and cybersecurity controls. Environmental risks affect patient safety and operational continuity. Healthcare facilities must address fire hazards, hazardous materials, and infrastructure failures. Incident reporting systems help identify near misses and adverse events, providing valuable information for learning and improvement. A near miss is an event that could have caused harm but didn't. Identifying near misses helps prevent future incidents by learning from these close calls. Safety rounds involve leaders and staff inspecting clinical areas to identify risks in real time. Regular inspections enhance safety awareness and accountability. Audits evaluate compliance, performance, and effectiveness. They uncover risks and provide evidence-based information for improvement. Patient feedback provides insights into healthcare risks that data alone may not capture. Listening to patients is a key risk management strategy. Data analytics help identify patterns and predict risks, transforming reactive measures into proactive ones. This approach protects patients and enhances care quality. A risk register records identified risks, their impact, and mitigation strategies. Regular updates ensure effective governance and oversight. A hospital improved turnaround times and reduced treatment delays through structured risk identification processes, enhancing patient care and safety. Healthcare organizations gather risk information from multiple channels. A multi-channel approach provides a comprehensive understanding of risks. Proactive identification allows organizations to prevent issues before they escalate, improving outcomes and patient satisfaction. Risk identification is the foundation of effective healthcare risk management. By recognizing threats early, organizations improve patient safety and enhance resilience. In this chapter, we delve into risk assessment and analysis techniques crucial for prioritizing healthcare risks and supporting informed decision-making. Risk assessment evaluates risks by examining their likelihood and potential impact, transforming them into actionable priorities for informed decisions. Risk assessment is vital for identifying which issues require urgent action and which can be monitored over time, ensuring proportional responses. Risk assessment evaluates likelihood and impact, with some organizations considering additional factors to enhance decision quality. Likelihood measures the probability of a risk event occurring, with structured scales to ensure consistent ratings across categories. Impact measures the severity of consequences if a risk event occurs, affecting multiple dimensions simultaneously. Risk scores standardize evaluation across departments, ensuring consistent assessments and prioritization for mitigation. The risk matrix categorizes risks based on likelihood and impact, helping leaders prioritize actions efficiently. Low-risk events require minimal resources and can be managed through routine monitoring and departmental oversight. Moderate risks need active monitoring and targeted controls, often requiring specific departmental oversight. High-risk events demand immediate attention and coordinated action across the organization to prevent serious consequences. Qualitative risk analysis uses expert judgment and workshops to assess risks when quantitative data is unavailable. Quantitative analysis uses data and predictive models to estimate risk probabilities and impacts with precision. FMEA is a proactive technique to identify potential process failures before they occur, enabling targeted prevention strategies. Root cause analysis identifies underlying causes of risks, strengthening future prevention strategies. Risk prioritization ensures resources are directed toward the most significant threats, following a structured hierarchy. A case study on medication safety shows how risk assessment focuses resources on critical issues, improving outcomes. Risk category distribution helps organizations manage risks according to severity, ensuring appropriate attention and resources. Risk priority comparison helps organizations focus on the most significant threats, ensuring effective resource allocation. Effective risk assessment is essential for sustainable risk management in healthcare, supporting patient safety and organizational strength. Patient safety is a key objective in healthcare risk management, focusing on delivering safe, effective, and high-quality care while minimizing preventable harm. Patient safety involves preventing errors, injuries, and harm in healthcare settings. It includes error prevention, injury reduction, infection control, and avoiding harm. Clinical risk management focuses on identifying, assessing, controlling, and monitoring risks to improve patient care and reduce harm. Unsafe healthcare can lead to injuries, increased costs, and loss of trust. Effective safety systems benefit patients, healthcare workers, and organizations. Understanding common safety risks helps prioritize prevention efforts across clinical settings, including medication errors, patient falls, and communication failures. Medication errors are a major concern, but standardized procedures can significantly reduce these risks. Patient fall prevention is crucial, involving risk assessment, environmental controls, and patient engagement to reduce incidents. Healthcare-associated infections can be reduced through hand hygiene, isolation protocols, sterilization, and surveillance. Effective communication prevents adverse events in healthcare settings. Proven solutions include structured communication protocols. Diagnostic errors can significantly affect patient outcomes. Accurate diagnosis is critical for effective treatment. Surgical safety programs prevent errors through standardized protocols and team-based verification. Human factors in healthcare involve system design and training to reduce errors caused by fatigue, distractions, and poor communication. A positive safety culture encourages reporting concerns and continuous improvement, transforming incidents into learning opportunities. Clinical audits evaluate healthcare practices to identify risks and improve patient safety through evidence-based action. Patient engagement in safety involves asking questions, reporting concerns, verifying medications, and participating in decisions. Safety improvement programs transform goals into measurable results through checklists, simulation training, root cause analysis, and performance monitoring. A case study on fall prevention in elderly care shows how targeted interventions can significantly improve safety outcomes. Monitoring patient safety incidents helps allocate resources effectively to reduce risks and improve outcomes. Safety improvement efforts lead to measurable reductions in adverse events and improvements in healthcare quality. Patient safety and clinical risk management are central to healthcare excellence, with every professional playing a role in achieving it. Healthcare quality improvement and risk reduction are essential for enhancing patient outcomes and organizational performance. This chapter explores methodologies that support healthcare risk management objectives. Quality improvement is a systematic approach to enhancing healthcare processes by identifying opportunities, implementing changes, and measuring results. It involves recognizing areas for improvement, applying evidence-based changes, evaluating outcomes, and fostering continuous learning. Improving healthcare quality reduces risks such as errors and compliance failures. High quality leads to lower risk across all performance dimensions, enhancing patient safety and operational resilience. Healthcare quality includes dimensions like safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. These dimensions provide a framework for evaluating and enhancing care delivery. Continuous improvement in healthcare involves small, ongoing changes that lead to significant long-term benefits. This philosophy focuses on observing, innovating, implementing, and evaluating processes to enhance patient care. The Plan Do Check Act (PDCA) cycle is a widely used model for quality improvement. It involves planning changes, implementing them, evaluating results, and standardizing successful practices for continuous improvement. Lean healthcare principles focus on eliminating waste and improving workflow efficiency. By identifying value, mapping the value stream, creating flow, establishing pull, and pursuing perfection, healthcare organizations can enhance patient care. Six Sigma is a data-driven methodology that reduces process variation and defects. It involves defining, measuring, analyzing, improving, and controlling processes to enhance healthcare quality and efficiency. Process mapping helps identify inefficiencies and redesign workflows for improvement. It involves assessing the current state, identifying gaps, redesigning processes, testing, and full implementation. Performance indicators help measure and monitor improvement efforts in healthcare. By focusing on clinical quality, patient experience, and operational performance, organizations can ensure activities are aligned with patient and organizational needs. Root cause analysis identifies underlying issues affecting patient safety. By examining people, processes, technology, and more, organizations can implement effective solutions to prevent future incidents. Patient-centered quality improvement focuses on enhancing experiences, communication, and access to care. These efforts improve both quality and satisfaction, creating a cycle of better care. Engaging frontline staff in improvement processes is crucial. Their insights into daily operations can drive meaningful changes. Strategies include creating psychological safety, involving staff in design, and recognizing contributions. Technology enhances healthcare quality by providing better data access, decision support, and analytics. Electronic health records, clinical decision support, and analytics platforms are key components in this advancement. Risk reduction strategies involve redesign, education, technology, and monitoring. Effective interventions target root causes rather than symptoms, leading to lasting improvements. Improvement success is measured using baseline data, intervention monitoring, and evaluation. Organizations track indicators to determine effectiveness and guide future improvements. A case study on emergency department wait times shows how structured quality improvement can lead to significant operational benefits. By using process mapping in PDCA methodology, patient satisfaction and efficiency improved. Quality improvement projects deliver measurable gains in patient satisfaction, error reduction, and engagement. Structured programs ensure consistent delivery of these benefits across clinical, operational, and experiential dimensions. Monitoring trends in adverse events helps evaluate risk reduction success. Sustaining performance below target rates signifies a significant patient safety achievement. Healthcare quality improvement and risk reduction work together to create safer, more effective systems. Embracing continuous improvement strengthens patient safety, operational performance, and long-term resilience. In this chapter, we delve into the critical aspects of regulatory compliance and accreditation in healthcare. These elements are vital for ensuring patient safety, quality care, and public trust. Regulatory compliance involves adhering to laws and standards that govern healthcare operations. It ensures legal accountability while protecting patients and healthcare workers. Non-compliance can lead to financial penalties, legal action, reputational damage, operational disruption, and patient safety risks. Effective compliance programs mitigate these risks. The healthcare regulatory environment is shaped by national laws, professional standards, and privacy regulations. These elements ensure safe and effective healthcare delivery. Government regulators play a crucial role in maintaining accountability within healthcare systems. They oversee activities, conduct inspections, investigate complaints, and enforce requirements. Accreditation is a formal process that evaluates whether healthcare organizations meet quality and safety standards. It promotes continuous improvement and risk reduction. Major accreditation organizations set benchmarks for healthcare quality and safety. These standards transcend national boundaries, ensuring global excellence. Compliance in healthcare focuses on patient safety. Regulations in medication management, infection prevention, and documentation ensure high-quality care. Protecting patient information is a fundamental compliance obligation. Privacy regulations govern every stage of the data lifecycle, ensuring secure collection, storage, access, and sharing. Accurate documentation supports clinical care, legal protection, and quality improvement. Incomplete records can lead to significant risks for healthcare organizations. Healthcare organizations must ensure staff possess the necessary skills and knowledge. Ongoing education and competency assessments are crucial for maintaining compliance. Compliance audits provide evidence of adherence to regulations. They help identify weaknesses and implement corrective actions before issues escalate. Organizations use corrective and preventive actions to address compliance deficiencies. These measures strengthen controls and reduce future risks. Compliance risk assessments identify areas of potential non-compliance. They help prioritize resources and ensure effective oversight. A strong compliance culture encourages ethical behavior, accountability, transparency, and integration into daily operations. It is essential for organizational success. Technology supports regulatory oversight by improving visibility, efficiency, and consistency. Tools like compliance management software and analytics platforms are essential. A hospital's accreditation preparation involved addressing documentation deficiencies and updating policies. This led to successful accreditation and improved patient safety. Patient safety and privacy are top compliance priorities. Effective programs allocate resources to the highest priority domains, ensuring rigorous monitoring and control. Continuous monitoring and improvement in compliance systems lead to better outcomes and efficiency. This trajectory strengthens organizational performance over time. Regulatory compliance and accreditation are essential for patient safety, legal accountability, operational excellence, and organizational resilience. They support long-term success in healthcare. Healthcare organizations face incidents ranging from minor deviations to serious safety events. Effective incident reporting and investigation systems help organizations learn from these events and prevent recurrence. In this training, learners will explore incident reporting processes and root cause analysis methodologies used worldwide. An incident is any event that could result in harm or has resulted in harm to patients, staff, or property. Understanding incidents is the first step toward organizational learning and improvement. Incident reporting provides organizations with valuable information about system weaknesses, process failures, and emerging risks. It supports proactive risk management and continuous improvement. Healthcare organizations manage a wide variety of incident types. Understanding these categories helps teams prioritize responses and allocate resources effectively. An adverse event is an incident that results in patient harm. These events may range from minor injuries to serious complications requiring additional treatment or intervention. Near misses are incidents that could have caused harm but were prevented through timely intervention. They provide valuable learning opportunities without the burden of actual patient harm. Organizations with strong reporting cultures encourage employees to report incidents without fear of punishment. Open reporting improves transparency and organizational learning. Effective reporting systems are accessible, confidential, user-friendly, and supported by leadership. They encourage timely reporting and facilitate analysis across the organization. Organizations should encourage reporting of a broad range of events and concerns. Comprehensive reporting helps identify patterns and trends that might otherwise go unnoticed. Incident investigations seek to understand what happened, why it happened, and how recurrence can be prevented. The focus should remain on learning rather than assigning blame. Root cause analysis, often called RCA, is a structured method used to identify underlying causes of incidents. The goal is to address system weaknesses rather than surface-level symptoms. RCA transforms incidents into organizational learning opportunities that make systems safer for everyone. It focuses on understanding contributing factors and developing corrective actions. The 5 Whys technique explores causes by repeatedly asking why an event occurred. This simple yet powerful method helps uncover deeper organizational causes. Fishbone diagrams help visualize contributing factors across different domains, ensuring comprehensive investigations by addressing all potential causes. Following RCA, organizations implement corrective actions to address identified root causes. These actions ensure sustainable improvements. After corrective actions are implemented, organizations must evaluate whether changes have successfully reduced risks and prevented recurrence. Continuous monitoring confirms whether improvements are working as intended. A hospital experienced repeated medication administration errors. Root cause analysis identified key areas for improvement, leading to significant reductions in medication-related incidents. Healthcare organizations analyze incident trends to identify priority areas for improvement. Understanding the distribution of incident types helps leaders allocate resources and focus quality improvement efforts where they are needed most. Organizations frequently achieve measurable improvements after implementing root cause analysis findings and corrective actions. Continuous learning and corrective action can significantly reduce incidents over time. Incident reporting and root cause analysis are essential components of healthcare risk management. By promoting open reporting cultures and focusing on system improvement, healthcare organizations can strengthen patient safety and prevent future incidents. Medical errors and adverse events are significant challenges in healthcare. Understanding both is crucial for improving safety and reducing risk. This chapter explores causes, prevention, and management of these issues. A medical error is a preventable failure in healthcare processes that may or may not harm the patient. Errors can occur in various stages, from diagnosis to documentation. An adverse event is harm from medical care rather than the patient's condition. Some result from errors, others despite proper care. All require careful evaluation and response. Medical errors focus on process failures, while adverse events focus on outcome harm. Errors may not cause injury, but adverse events may occur even with proper procedures. Medical errors can occur at any point in care, including medication mistakes, treatment delays, and documentation errors. Understanding these types helps in prevention. Medication safety is crucial as errors can lead to adverse events. Errors can occur in prescribing, dispensing, administration, and monitoring stages. Diagnostic errors involve missed, delayed, or incorrect diagnoses, affecting treatment decisions and increasing complication risks. Communication errors among healthcare providers can lead to misunderstandings and patient safety incidents. Addressing these is vital for safe care. Human factors like fatigue, cognitive overload, and stress contribute to errors. Addressing these can improve clinical settings. System failures often hide latent risks that lead to errors. Addressing these risks is more effective than focusing solely on individual performance. Early detection of adverse events helps organizations respond quickly and effectively. Multiple methods are used to identify and investigate contributing factors. Effective communication after adverse events is crucial. Organizations must acknowledge the event, provide information, offer support, and follow up with patients and families. Investigating adverse events helps identify improvement opportunities. Focus on learning rather than blame to strengthen systems and prevent future events. Preventing medical errors requires a multi-layered approach involving culture, technology, protocols, education, and monitoring. Technology enhances patient safety when combined with strong processes and staff training. CDG Training emphasizes this integration for effective error prevention. Organizations should learn from adverse events to improve systems and enhance safety. A learning culture transforms incidents into lasting improvements. A case study on medication safety shows how focused solutions can lead to significant patient safety improvements. Healthcare organizations monitor error categories to identify trends and prioritize safety initiatives. Medication and communication errors are significant sources. Comprehensive safety initiatives lead to measurable reductions in adverse events. Continuous improvement efforts are essential for sustained patient safety. Medical errors and adverse events are critical concerns in healthcare. CDG Training provides practical approaches to prevent and manage these issues, improving patient outcomes. Healthcare-associated infections pose significant challenges to patient safety. Effective prevention programs protect patients, healthcare workers, and visitors while reducing risks. This chapter explores infection prevention principles, transmission pathways, and risk management strategies. Healthcare-associated infections, or HAIs, are acquired during healthcare delivery. They differ from infections present at admission. Key characteristics include their impact on patients, healthcare workers, and visitors, and their occurrence due to healthcare settings. In the U.S., 1.7 million HAIs occur annually, leading to 99,000 deaths and costing $28 billion. These infections increase patient morbidity and healthcare costs, highlighting the importance of prevention. Different types of HAIs require specialized prevention strategies. Understanding each category helps allocate resources effectively for targeted interventions. The chain of infection illustrates how infections spread. Breaking any link can reduce transmission and protect patients. Understanding this chain is crucial for effective interventions. Infections can spread through various pathways. Identifying specific transmission routes for each pathogen supports targeted interventions. Hand hygiene is a crucial method for preventing infections. Proper hand washing and alcohol-based rubs significantly reduce pathogen transmission. Personal protective equipment, or PPE, includes gloves, gowns, masks, and eye protection. Proper use of PPE creates barriers against pathogen transmission. Regular cleaning and disinfection reduce contamination and infection risks. High-touch surfaces require special attention for effective infection control. Medical devices must be cleaned, disinfected, and sterilized to ensure patient safety. Proper sterilization prevents infection and ensures equipment functionality. Isolation precautions help prevent infection transmission within healthcare facilities. They include standard, contact, droplet, and airborne precautions, each tailored to specific pathogens. Antimicrobial stewardship promotes responsible antibiotic use to reduce resistance and improve patient outcomes. It involves selecting the right drug, dose, and duration. Surveillance systems monitor infection rates, detect outbreaks, and evaluate prevention programs. Robust surveillance is key to evidence-based infection prevention. Healthcare organizations must be ready to detect, investigate, and contain outbreaks. Rapid response reduces transmission and protects healthcare operations. Continuous education ensures healthcare workers understand infection prevention policies and best practices. Training is essential for effective infection control. Patients and visitors play a crucial role in infection prevention. Engaged individuals can significantly reduce infection rates through proper hygiene and adherence to guidelines. A case study on CAUTI reduction shows how targeted strategies can improve patient safety outcomes. Continuous monitoring and intervention are key to success. Understanding infection types helps prioritize prevention efforts. Pneumonia and surgical site infections are the largest categories, guiding resource allocation. Comprehensive infection prevention programs achieve substantial reductions in infection rates. Consistent efforts and staff education are crucial for success. Infection prevention is vital for healthcare risk management and patient safety. Effective programs protect patients, staff, and the broader community. Healthcare organizations increasingly rely on digital technologies, which introduces new cybersecurity and operational risks. This chapter explores these challenges and strategies for managing them effectively. Digital transformation in healthcare enhances patient outcomes and operational efficiency through technologies like EHRs, telehealth, and AI systems. Cybersecurity is crucial for protecting digital systems and ensuring patient safety across healthcare settings. Key areas include systems, devices, and data integrity. Healthcare is a prime target for cyberattacks due to the critical nature of patient data, financial records, and operational systems. Cyber threats in healthcare include ransomware, phishing, malware, insider threats, and supply chain vulnerabilities, each posing significant risks. Ransomware attacks encrypt data until a ransom is paid, severely impacting healthcare operations and patient care. Phishing and social engineering exploit human behavior to gain unauthorized access, posing significant cybersecurity risks. Data breaches expose sensitive information, leading to legal, financial, and reputational damage, as well as patient safety risks. Electronic health records improve efficiency but pose risks like unauthorized access, data integrity issues, and cyber vulnerabilities. Connected medical devices are vulnerable to cybersecurity threats, requiring secure firmware, network access, and vendor management. Telehealth services expand access but introduce risks like privacy vulnerabilities and data transmission security challenges. Cloud computing supports healthcare operations but introduces risks related to data storage, third-party providers, and service availability. Protecting patient information is both an ethical and regulatory responsibility, involving access controls, encryption, and privacy policies. Cybersecurity risk assessments identify vulnerabilities and help prioritize improvements, ensuring strategic protection of healthcare systems. Employee awareness is a strong defense against cyber threats, emphasizing the importance of training in recognizing phishing and maintaining password hygiene. Incident response planning is crucial for effectively managing cybersecurity incidents, involving preparation, detection, containment, and recovery. A case study on ransomware response highlights the importance of preparation and resilience in managing cybersecurity incidents. Phishing and ransomware are the most common cyber threats in healthcare, emphasizing the need for awareness and robust recovery systems. Improving cybersecurity maturity involves continuous investment in people, processes, and technology to strengthen resilience over time. Cybersecurity is an organizational priority, focusing on protecting information, securing technologies, managing threats, and maintaining continuity. Healthcare organizations face a wide range of risks that extend beyond patient care. Financial instability, operational disruptions, and reputational damage can significantly impact an organization's ability to deliver quality healthcare services. In this CDG training chapter, learners will explore how healthcare organizations identify, assess, and manage these critical risk categories. Enterprise risks affect the overall performance and sustainability of an organization. Financial, operational, and reputational risks often interact and influence one another, creating a complex web of interdependencies that leaders must navigate strategically. Financial risk refers to the possibility of losses resulting from budgeting issues, revenue fluctuations, reimbursement changes, and unexpected expenses. Financial stability is the foundation upon which long-term healthcare operations and patient services are built. Healthcare organizations face financial risks from a broad spectrum of internal and external forces. Understanding these sources is the first step toward effective mitigation. Fraud risks may include billing irregularities, procurement fraud, payroll manipulation, or misuse of organizational resources. Strong internal controls help reduce these risks and protect organizational integrity. Operational risks arise from failures in processes, systems, people, or infrastructure. These risks can affect service delivery, patient care, and organizational performance, making operational resilience a strategic priority for healthcare leaders. Healthcare organizations depend on skilled professionals to deliver safe, high-quality care. Workforce shortages, burnout, turnover, and inadequate staffing levels can create significant operational challenges that ripple across the entire organization. Healthcare supply chains support access to medications, medical devices, personal protective equipment, and critical resources. Disruptions can affect patient care and operational continuity in profound ways. Healthcare facilities depend on reliable power, water, communication systems, and physical infrastructure. Failures can disrupt operations and compromise patient safety, making infrastructure resilience a critical organizational priority. Reputational risk refers to the possibility of negative public perception affecting an organization's credibility, trust, and stakeholder confidence. Reputation is one of the most valuable and most fragile organizational assets in healthcare. Reputational risk arises from both internal and external events, including regulatory violations, cybersecurity breaches, poor service quality, and negative media coverage. Understanding these sources is vital for effective reputation management. Patient experiences significantly influence organizational reputation. Positive interactions build trust, while poor experiences can affect public perception and patient loyalty in lasting ways. Social media can rapidly influence public opinion. Healthcare organizations must monitor online discussions and respond appropriately to emerging concerns before they escalate into reputational crises. Organizations reduce financial, operational, and reputational risks through a combination of governance, internal controls, contingency planning, staff training, communication strategies, and performance monitoring. Business continuity plans help organizations maintain critical operations during disruptions. CDG training emphasizes continuity planning as a key component of organizational resilience, enabling prepared organizations to recover more quickly from unexpected events. Healthcare organizations use dashboards, financial reports, operational metrics, and patient satisfaction indicators to monitor risk exposure and organizational performance. Continuous monitoring helps leaders identify emerging risks early, before they escalate into crises. A healthcare network experienced supply chain disruptions affecting access to critical medical supplies. Leadership responded with a strategic, multi-phase approach that transformed a crisis into an opportunity to build lasting operational resilience. Healthcare organizations often allocate risk management resources across multiple enterprise risk categories. Understanding the relative weight of each category helps leaders prioritize investments and governance attention appropriately. Organizations implementing comprehensive risk management programs frequently achieve measurable improvements in operational performance and organizational resilience. The data below illustrates typical performance gains before and after implementing structured risk management programs. By understanding and managing these interconnected risks, healthcare organizations strengthen resilience and improve long-term sustainability in delivering quality care. Healthcare organizations must be prepared to respond rapidly to emergencies, disasters, and crises that threaten patient safety and operational continuity. Effective preparedness minimizes disruption, protects lives, and supports organizational resilience. Emergency preparedness involves planning, training, and organizing resources to effectively respond to unexpected events. This includes natural disasters, disease outbreaks, cyber attacks, and infrastructure failures. Preparedness enables organizations to respond effectively during challenging situations, protecting patients, staff, and communities. Crisis management involves coordinating actions during and after significant events to reduce harm, maintain operations, and support recovery. Key components include leadership, communication, decision-making, and resource coordination. These elements ensure an organization can navigate through a crisis to full recovery. Healthcare organizations must prepare for a wide variety of emergencies, each requiring tailored response strategies and resources. From infectious disease outbreaks to security threats, no single emergency can be predicted with certainty. Comprehensive preparedness plans must address the full spectrum of potential threats. Emergency management typically follows four interconnected phases: preparedness, response, recovery, and mitigation. Each phase contributes to organizational resilience and continuity, feeding into the next in a continuous cycle of improvement. Hazard Vulnerability Analysis, HVA, identifies potential threats and evaluates their likelihood and impact. Organizations use this process to prioritize preparedness efforts and reduce their vulnerability to emergencies. Emergency Operations Plans, EOPs, define responsibilities, communication procedures, resource allocation, and response actions during emergencies. These plans provide critical structure during stressful, fast-evolving situations. The Incident Command System, ICS, provides a standardized structure for managing emergencies. It includes clear leadership roles, reporting relationships, and communication channels to ensure focused and coordinated responses. Emergency preparedness requires effective management of all critical resources. Organizations must identify, track, and deploy resources rapidly when emergencies occur, ensuring personnel, equipment, transportation, and communication systems are ready and available. Communication is one of the most critical components of crisis management. Accurate, timely, and transparent communication supports coordination, maintains public confidence, and stops the spread of misinformation. Healthcare organizations must prepare for infectious disease outbreaks through comprehensive, coordinated strategies that span surveillance, clinical operations, and community response. Organizations with robust pandemic plans are better positioned to protect patients and staff while maintaining essential services. Cybersecurity incidents can disrupt patient care, communication systems, and healthcare operations at scale. Prepared organizations establish cyber incident response procedures and recovery plans before an attack occurs. Mass casualty incidents create sudden surges in patient volume that may exceed normal healthcare capacity. Surge planning helps organizations manage these situations effectively while maintaining quality of care. Business continuity planning ensures significant operations are maintained, even after emergencies. Recovery efforts may continue long after the immediate response, focusing on restoring normal operations and improving resilience. Organizations conduct drills, simulations, tabletop exercises, and emergency training programs to test preparedness and improve response capabilities. Regular exercises help build muscle memory, strengthen team coordination, and reveal plan weaknesses before they matter most. Effective leaders provide direction, maintain situational awareness, communicate clearly, and support decision-making under pressure. Leadership quality directly influences team responses during crises and supports recovery efforts. A regional flooding event serves as a practical case study, demonstrating the real-world value of comprehensive preparedness. From hazard identification to recovery and learning, each step showcases the importance of planning and coordination in managing complex emergencies. Risk assessments help healthcare organizations develop preparedness plans. Risk awareness encourages proactive preparedness investments and allocates resources to mitigate potential impacts of emergencies. Organizations that invest in preparedness programs see dramatic improvements in emergency response capabilities and resilience over time. Continuous improvement strengthens organizational resilience and response capability. Emergency preparedness and crisis management are essential components of healthcare risk management. By preparing before crises occur, organizations can protect patients and maintain critical services during emergencies. Enterprise risk management in healthcare organizations is crucial for identifying, assessing, managing, and monitoring risks across various domains. This chapter explores how ERM strengthens resilience and supports strategic objectives. Enterprise risk management is a structured approach to managing risks across an organization. It shifts the focus from reactive to proactive, integrating oversight across all domains. In healthcare, a single incident can cascade across multiple domains. ERM helps understand these relationships, preventing isolated fixes and promoting coordinated responses. The evolution of risk management shows a shift from siloed approaches to integrated, enterprise-wide strategies. Modern ERM aligns risk management with strategic planning and objectives. ERM combines multiple risk management activities into a cohesive framework, enhancing decision-making at every level. Key components include governance, risk identification, assessment, mitigation, and continuous improvement. Risk governance establishes accountability and oversight, ensuring risk management supports organizational strategy. Effective governance involves clear reporting lines and decision-making processes. Strategic risks affect an organization's ability to achieve long-term goals. These include policy changes, competitive pressures, workforce shortages, and technological disruptions. Clinical risks are central to healthcare organizations. ERM integrates patient safety, quality improvement, infection prevention, and clinical governance to ensure these concerns receive appropriate attention. Operational risks involve people, processes, systems, and infrastructure. Effective ERM identifies vulnerabilities and improves service reliability, ensuring consistent healthcare delivery. Financial risks include revenue challenges and reimbursement changes. ERM helps healthcare organizations manage these risks, ensuring financial stability and prioritizing risk management. Digital health technologies create both opportunities and risks. ERM integrates cybersecurity, privacy, and digital resilience into organizational planning, recognizing their importance in healthcare environments. Legal and compliance risks require continuous monitoring and oversight. embeds compliance awareness into daily operations, moving organizations from reactive responses to anticipatory risk management. Risk appetite defines the level of risk an organization is willing to accept, while risk tolerance sets acceptable limits for specific events. These concepts guide strategic decision-making and performance indicators. An enterprise risk register documents significant risks, responsibilities, and mitigation strategies. It serves as a central management tool for programs, ensuring visibility and accountability. Programs rely on dashboards and reporting to communicate risk information to leadership. Timely, accurate reporting enables informed decision-making and crisis response. Organizations with mature programs outperform peers across multiple dimensions. Supports both risk reduction and organizational growth, making it a strategic investment for resilience. A healthcare network implemented an program, improving resilience and decision-making across facilities. Centralized governance and integrated reporting were key to this transformation. Healthcare organizations monitor risk exposure across multiple categories. Understanding the weight of each domain helps prioritize mitigation efforts effectively. Maturity leads to measurable improvements in governance, resilience, and performance. Continuous improvement strengthens effectiveness across all domains. Enterprise risk management provides a comprehensive framework for managing risks across healthcare organizations. By integrating various risk categories, strengthens governance, decision-making, and resilience. Healthcare risk management thrives when integrated into organizational culture, governance, and daily operations. This chapter explores how to build sustainable risk management programs while supporting resilience and professional growth. A sustainable risk management program is consistent, adaptable, engages stakeholders, and continuously improves. These elements ensure leadership commitment and organizational support. Visible leadership support is crucial for successful risk management. Leaders set expectations, allocate resources, and demonstrate accountability for safety and organizational resilience. Integrating risk management into daily operations involves clinical workflows, operational processes, compliance activities, and strategic planning. This integration enhances efficiency and safety. A strong safety culture encourages reporting, promotes learning, ensures transparency, and fosters collaboration. These elements drive systemic improvement and risk reduction. Continuous risk identification involves assessing emerging technologies, regulatory changes, healthcare innovations, and evolving threats. This proactive approach prevents unforeseen risks. Data-driven decision-making uses analytics, dashboards, and performance indicators to guide risk management decisions and evaluate program effectiveness. Continuous training ensures employees understand evolving risks and safety expectations. Onboarding, role-specific training, and ongoing refreshers build organizational resilience. Performance measurement involves KPIs, SLAs, CHI, and comprehensive reviews. These metrics help organizations analyze progress and drive improvement. Effective communication supports collaboration, accountability, learning, and trust. Transparent systems encourage participation and continuous improvement. Technology and automation are reshaping risk management. AI, predictive analytics, digital platforms, and automation create new opportunities for improvement. Regulatory readiness involves continuous monitoring, gap analysis, audit preparation, and rapid adaptation. Prepared organizations adapt more effectively to changes. Resilient organizations anticipate challenges, adapt, recover, and respond effectively. Resilience is key to delivering essential services during crises. Global trends in healthcare risk management include patient safety, digital transformation, cybersecurity, workforce resilience, and quality improvement. These trends address evolving challenges. Professional development supports career advancement in risk management. Foundation education, certification, continuing education, and leadership advancement are key opportunities. The course covered governance, safety, compliance, technology, and emergency preparedness. These topics form the foundation of effective healthcare risk management. A case study on enterprise-wide risk management shows how integrated programs create sustainable benefits. Long-term commitment to risk management produces measurable results. Organizations develop risk management maturity through defined processes and continuous improvement. Progressing through maturity levels reflects growing capability and commitment. Congratulations on completing the course. Apply your knowledge to enhance healthcare systems, governance, compliance, and resilience in your professional journey. Get certified with CDG Training to enhance your professional credentials. Enjoy flexible learning, online exams, and digital certification to advance your career.